I want to reach out to some of our other federal partners. Perhaps our individuals from the Department of Justice or Department of Education. What would any other federal? Would you like to share what is being done to prevent violence prevention in the school systems?
This is Tom Hoyt at the National Institute of Justice. Thanks, and thanks for including us. Our partnership with CDC is a terribly important one. Of course, just tracking the data in the first place and looking at school-associated violent deaths is a critical part to knowing the nature of the problem and the type of preventive strategies that will work. We've been conducting some important research around police officers in schools and trying to look at the most effective ways to allocate scarce law enforcement resources to ensure the safety of kids. And of course, a lot of what the SAVD data show is that school-associated deaths don't always happen in the schools, and in fact, schools are pretty safe places overall. We're also looking at things like routes and neighborhoods that kids go through on their way to school.
This is Paul Kestner from Department of Education. I concur. Thanks so much for having us a part of this. And I believe some of what Tom just said is what we're looking at as well. The data is showing schools are pretty safe places to be. So what we've been doing is enhancing some of our training for bus drivers, looking for signs of bullying, that sort of thing. We've also been using the data to drive some of our technical assistance efforts, where we found through the efforts of StopBullying.gov that there are a variety of resources out there that folks can use to help target and talk with young people about some of the concerns about bullying. In addition, we've been also working with helping develop some strategies for teaching our teachers, some in-class strategies for possibly violent situations that may arise, and giving them some ways to target their own behavior at addressing those concerns.
Thank you, both Tom and Paul. Oh, we have Don. Would you like to speak?
So I was just going to add, so NIOSH has recently been looking at violence against teachers, and we've done a survey in Pennsylvania that shows that about 10% of teachers on an annual basis are subject to violence, often from the students. And we've had some initial discussions with the Injury Center about partnering to look at the schools on a holistic basis, looking at safety of both the children as well as the staff within the schools.
Thank you, Don, Tom, and Paul. It's great to see such wide participation across the federal family in preventing violence in the schools. The next question I'm going to send to Don and to Dr. Holmes from OSHA. What is OSHA's role in preventing workplace violence?
Hi, thanks for including us today. OSHA's done a lot of work in terms of guidelines out to different types of workplaces, and those are all posted on our website. We also track kind of what's going on in the state, so we also have all of the laws listed that have been passed as it relates to workplace violence. We have 10 regions, and we have workplace violence coordinators in each of those regions that reach out to workplaces throughout their regions to talk about workplace violence. And we've also been doing outreach with our own inspectors so that when they're doing inspections, they can reach out to employers and identify steps they can take to help improve the safety at their workplaces.
Do you want to add to that, Don?
Yeah, so OSHA is a tremendous partner for us. They are very important to employers, and so when they conduct the outreach and they share the findings on the research, they're listened to, and so we value that partnership and their efforts to leverage some of the science.
Great, thank you. Dr. Sondick, another question for you. Does exposure to violence in children include violence in video games?
Tom Foyt might want to join in with this. It does not include that. There's 44 different types of violence that are included that range from very direct violence to somewhat indirect violence, but that aspect is not included. And I must say that's exactly the same question that I asked when I first looked at this data. It is quite surprising, the high level here, and I think it's very important. Tom, do you want to add anything to that?
Well, I think that focusing on young people, as your data showed, Ed, is terrifically important. One of the things that NIJ has developed in the last few years, and other agencies as well, is a focus on teens and their relationships. And this involves all sorts of things: teen dating, some of the bullying that occurs in different media, and so on. And we've got a portfolio of research that's up on our website that people can visit if they want to look at some of that. These are really, really important issues because youth are at such risk, and also because of the developmental and preventive opportunities that we have in working with young people.
Let me just add something. If you look at the slide, it's difficult to see, I know, over the internet, but if you download the slide, there is a footnote that goes into some of these types of violence, that mentions some of these types of violence. And just let me mention it, because I really think it's quite important. They're conventional crime, child maltreatment, peer and sibling victimization, sexual victimization, witnessing and indirect victimization, school violence and threat, internet harassment and threats. And again, video games are not included in that list.
Thank you, Ed. Next question is for you, Dr. DeGutis. What % of poisonings are intentional versus accidental?
Unplanned question. Go ahead. Hi. Okay. Thank you. This is one of the, and if you're talking about fatal poisonings, one of the issues that we have, or one of the difficulties we have, is really identifying what proportion of them really are intentional, because many of the poisonings that appear to be unintentional may actually be intentional. And we're trying now to develop ways to tease that out and identify where people are actually, taking an overdose intentionally. But from the medical examiner standpoint and death certificates, we've talked to a number of people who say that they still have difficulty in figuring out what's intentional and what's unintentional. So it's an area where we need some more work.
Thanks, Dr.
Go ahead.
Thank you, Dr. DeGutis. Dr. Sondik, do you have some additional thoughts on this question?
She's actually right on. One of the areas that we would definitely like to know more about is cause of death and information related to that. But the information that we do have, if we put it together, our best estimate at this point would be that 70% of these poisoning deaths are accidental, 15% are suicide, and 8% are just undetermined, we don't know. So the great majority, we would have to say at this point, are unintentional. And I emphasize what I had mentioned earlier, these are both legal and illegal drugs. The opioids are a growing problem here.
Thank you, Dr. Gudas, Dr. Sondik. The next question is for Don Castillo. One of our participants asked, I'm a safety professional and current board member of the American Society of Safety Engineers. We have 34,000 members focusing on workplace safety. What are the correlations from non-workplace violence to problems in the workplace, if any?
So thank you, and I'll note that the American Society for Safety Engineers is one of our valued partners, given the role that they play in workplace safety. So there are some overlaps. We talked about the fact that intimate partner violence is not limited to a home and that it often encroaches into the workplace. And then some of the violence that you see, we've talked about fighting among children and violence. Ultimately, those are the types of events that lead to criminal acts, and criminal acts are very much an issue within the workplace. So I hope that answers the question.